Good day, I'm Dr. Dimitri Kumanis, board certified plastic surgeon here at Capital Area Plastic Surgery in upstate New York. Thanks for joining us. Today we're going to talk about liposuction and who are good candidates, and we're also going to talk about a little bit of the other modalities that are like liposuction, like cool sculpting, and who's a good candidate for what procedure and why. One might be more advantageous in each situation over the other. So liposuction is, as most people know, is basically a long cannula hooked to a suction machine under sterile conditions in the operating room, and the plastic surgeon will suck out some of the fat in contoured areas. It is not a method of weight loss, although some weight is obviously and fat is taken away. It's more of a body contouring thing. So it's by taking excess fat and trying to contour the area, including the lower abdomen, sometimes the upper abdomen, the flanks, the inner thighs, the outer thighs, and the buttock area are the most common aspects. We also do liposuction sometimes under the arm here if there's good skin quality to take out some excess fat in the upper arms too. You may also need a tummy tuck with liposuction if there's also excess skin, because liposuction does not tighten the skin enough in most cases. Now, in some cases, if there's only a little bit of skin laxity, the liposuction technique, just from the rubbing and the friction, can cause some inflammation and tightening of the skin envelope. Now, a lot of patients ask me about cool sculpting, and cool sculpting is a less invasive way of reducing contoured fat areas, or contouring the fat areas, by placing these pads, which are cool, and basically melt the fat or freeze it, and then it melts and breaks down. And that is a good method in some areas too, but they're in specified areas. The advantages of surgical liposuction is that I can do large volumes, and it's a one-shot deal, even though you have to go under general anesthesia sometimes or most of the time. The procedure is not very invasive, and patients tolerate it very well, and I'm able to contour and have a lot more control. Now, that's not to say that cool sculpting doesn't have its place, because a lot of patients do very well with it in specific areas. The disadvantage of cool sculpting is it sometimes, and most of the time, requires multiple sessions. And so from a cost benefit, I always sit down with the patient, look at them first, and see which one benefits them the most when it comes to results, and also for the cost benefit for them. So please feel free to come and join us here for a free consultation at Capital Area Plastic Surgery. We'd love to talk to you. We'd love to talk to patients and their families. And so I hope to see you soon. Have a good day. Bye.